Welcome back, everybody, to the deep dive. This time, we're taking a close look at telepharmacy.
Telepharmacy.
Specifically, we've got a 2024 review article called A Review on Telepharmacy.
Okay.
And we're going to be diving deep into this. I think there's going to be some really interesting insights for everyone listening.
Sounds good.
So to start, let's just make sure everyone's on the same page. What exactly are we talking about when we say telepharmacy?
Well, you can think of it as providing pharmaceutical care, but doing it remotely using technology.
So like a virtual pharmacy.
Yeah, sort of. It can cover a lot of different services, like medication management, dispensing, even patient counseling.
All from a distance.
Exactly. That's the whole idea.
Yeah.
And it can happen in a couple of different settings.
Okay, so tell me more about these different types of telepharmacy.
Well, you've got inpatient telepharmacy, which is mostly within a hospital system.
Makes sense. So, like, a pharmacist could be off-site, but still review orders before they're given to a patient.
Exactly. It's a safety check even when they can't be there in person. And then there's outpatient telepharmacy, which can be a real lifeline for people in rural areas or places where pharmacists are hard to come by.
So someone in a remote area could still have access to, like, expert medication advice.
Exactly. It really helps level the playing field when it comes to healthcare access. And, the pandemic really highlighted how important this can be.
Oh, how so?
Well, the article mentions how some cities in India actually switched to mostly telepharmacy for outpatient services to reduce the spread of the virus.
Makes you think, right? Like, what other creative solutions are out there? Okay, so we talked about access, but the article also suggests that telepharmacy is actually changing the role of pharmacists themselves.
It is, yeah. It's giving them a chance to be more proactive with patient care.
In what way?
Well, they can spend more time on things like managing medications for chronic conditions, catching drug interactions early on, making sure patients really understand how to take their medications properly.
So they become more like partners in your healthcare.
Exactly. They have the time to really focus on individual needs. And that can lead to some pretty impressive benefits.
The article mentioned things like better healthcare services overall and higher patient satisfaction. What else are we seeing?
Well, think about the privacy aspect. If you need to discuss a sensitive health issue, telepharmacy lets you have that conversation from home, where you're more comfortable.
Right. Like sometimes you might not want to have those conversations in a busy pharmacy.
Exactly. You have more privacy, and the pharmacist has more time to answer your questions thoroughly.
And that probably takes some pressure off the pharmacist too, right?
For sure. It's a win-win, really. And then there's the potential impact on costs.
Oh, interesting. How so?
Well, better access can lead to more competition among pharmacies. Plus, it's easier for patients to compare prices from different places.
So more transparency and more options for patients?
That's the idea. It puts you more in control of your healthcare spending. Now, of course, it's not all sunshine and roses. There are some potential downsides to consider, too.
Right. No solution is perfect. What are some of those potential downsides that stood out to you?
Well, one thing that comes to mind is just the complexity of setting it all up. It requires a lot of coordination between healthcare providers, investing in the right technology, figuring out all the regulations, which can be different everywhere.
Sounds like a logistical challenge.
It can be. And then there's the whole issue of data privacy. You're dealing with sensitive medical information online, so security is paramount.
Absolutely. What about the human element? Not everyone is comfortable with technology.
That's a great point. Some people, especially older adults, they really value that face-to-face interaction with their pharmacist. They might miss that personal touch.
So how do we make sure technology enhances healthcare without losing that human connection?
It's all about finding the right balance and making sure technology serves the needs of the patient, not the other way around. We need to consider the needs of everyone.
I think that's a perfect place to pause for now. We've covered a lot of ground, but there's still so much more to explore.
Absolutely. We've only scratched the surface.
So stay tuned, because in the next part of our deep dive, we'll take a closer look at the specific types of telepharmacy services out there and how they're already making a difference in people's lives.
Should be fascinating. It really is amazing to see all the different ways telepharmacy is being used.
It is. We were just talking about inpatient and outpatient, but the article goes even deeper, talking about specific types of services.
Right, like, remote dispensing. That one really stood out to me.
Remote dispensing. So that's like actually getting your prescriptions filled remotely.
Exactly. It's especially helpful for people in those rural areas where getting to a pharmacy can be a real challenge.
So it's kind of like having a virtual pharmacy right there in your community.
That's a great way to put it. And it can take a lot of different forms, like those automated prescription kiosks you see popping up.
Right. But I guess it goes beyond just kiosks, right?
Oh, yeah, for sure. It can involve things like secure delivery systems or even mobile pharmacy units that can travel to remote communities. And get this, the article even mentioned a specific type of remote dispensing that focuses on IV admixture.
5E admixture. Now, that's a new one. What exactly is that?
So it's the process of preparing medications that are given intravenously. It's pretty complex, requires a lot of
I
expertise.
can imagine.
Well, with telepharmacy, a pharmacist can actually supervise this process remotely.
Wow, so they don't even have to be physically present.
Nope. They can be miles away and still make sure everything is done safely and accurately.
That's pretty amazing. Technology is really changing the game. Okay, so we've got medication dispensing covered. What about patient counseling? It seems like that would be a key part of telepharmacy too, right?
Absolutely. I mean, you want to make sure patients understand their medications, know how to take them properly, and feel comfortable asking any questions they might have.
Right, like what if you have a question about side effects or how a new medication might interact with something you're already taking?
Exactly. And with telepharmacy, you can have those conversations from home using video calls or other communication tools.
So you could essentially have a virtual face-to-face with your pharmacist whenever you need to.
That's the idea. And it's not just about providing information, it's also about, building trust and open communication between the patient and the pharmacist.
Right, that personal connection is still really important. It makes a big difference when you feel like your healthcare provider really listens to you and understands your concerns.
I couldn't agree more. It's all about that personalized care, making sure the patient feels heard and supported.
Okay, so I'm getting a better sense of how these services work. But what about the technology itself? What kind of tools are we talking about here?
Well, it can be as simple as a telephone call, but it also includes things like smartphones, online platforms, and even social media apps.
Social media?
Wait, really?
Yeah. The article mentioned how those secure messaging features you find on platforms like Facebook or WhatsApp, they can actually be used for things like medication reminders or quick check-ins with your pharmacist.
Huh. That's pretty innovative. I guess it makes sense to meet patients where they already are. But I imagine there's also some dedicated telepharmacy software out there too, right?
Oh, absolutely. There are platforms designed specifically for this, with features like secure video conferencing, electronic prescribing, you name it.
So the technology is really evolving to meet the needs of this growing field.
It is. But even with all the fancy technology, we can't forget about the human side of things. Implementing these services takes a lot of careful planning and coordination.
Right. It's not just about plugging in a computer and calling it a day. What are some of the key considerations for healthcare providers who want to get involved with telepharmacy? Well, the article really stressed the need for a multidisciplinary approach. It's not just pharmacists. It involves doctors, nurses, IT specialists, everyone working together.
So it's a team effort.
Exactly. Everyone needs to be on the same page about what services they're offering, how they'll deliver them, and of course, how to ensure patient safety and data security. Those are top priorities. And there also needs to be some clear guidelines and regulations.
Makes sense. We need to make sure telepharmacy is implemented responsibly.
Right, exactly. Like the article talked about how in India there's a call for a telehealth act, specifically to help standardize telepharmacy and ensure quality care. It's important to have a good framework in place.
Absolutely. Regulations help protect everyone involved, both patients and healthcare providers. But even with the best regulations and the best technology, I'm sure there's still challenges.
Oh, there definitely are. Compliance, for example. Not everyone's comfortable using technology, or maybe they don't have access to it.
That's true. We can't just assume that everyone has the same level of tech savviness or access to reliable internet. Those digital divides can create barriers to care.
Exactly. And then there's the financial side of things. Setting up these services can be expensive, especially for smaller healthcare providers.
So it's not as simple as just flipping a switch. There are a lot of factors to consider.
There are, but I think the potential benefits are worth it.
I agree. I'm really excited to hear more about how telepharmacy is already making a difference in people's lives. Are you ready to dive into some real-world examples?
Absolutely. Let's see how this technology is actually being used to improve healthcare and make it more accessible for everyone.
Okay, so let's get into it. What are some of the areas where telepharmacy is already making a real difference?
Well, one that really jumps out is chronic disease management. Things like diabetes, heart disease, asthma, conditions that need ongoing medication and regular checkups.
Right. And I imagine those are the folks who might have the hardest time getting to those regular appointments.
Exactly. It can be tough for people with mobility issues, transportation problems, even just busy schedules. Telepharmacy removes a lot of those barriers.
And it's more than just convenience, right?
No, absolutely. It's about improving outcomes, too.
How so?
Well, when it's easier for people to manage their conditions, they're more likely to stick with their treatment plans.
Right, Shades.
Fewer complications, fewer hospitalizations, better quality of life overall.
That makes a lot of sense. So we're talking about managing existing conditions. But what about preventing problems before they even start? Can telepharmacy help with that?
You bet. Think about it. It opens up all sorts of possibilities for early intervention.
Like what?
Well, pharmacists can be more involved in things like genetic testing, personalizing medication recommendations, even remotely monitoring vital signs.
Wow. So catching things early on.
Exactly. You can address potential risks before they become serious health issues.
It's like instead of waiting for something to go wrong, we're trying to stay ahead of the game.
That's the whole idea. It ties into this whole movement towards personalized medicine. Telepharmacy lets you really tailor healthcare to each individual's needs.
Their genes, their lifestyle, their health goals, the whole picture.
Right. It's like having a healthcare team designed just for you. And it doesn't stop at medication.
What do you mean?
Well, imagine pharmacists providing lifestyle counseling, dietary advice, even mental health support, all remotely through telepharmacy.
Wow. It's like a whole virtual health coach right there in your pocket.
I like that. And you bring up a great point about mental health. It's an area where we really need to improve access, and telepharmacy can be a big part of that, especially in underserved communities.
Definitely. But do you think there might be a hesitancy for some people to really open up about mental health issues through a screen?
Yeah, that's a valid concern. Not everyone's comfortable talking about sensitive stuff virtually, but telepharmacy isn't just about video calls.
Right.
It's also about access to online support groups, educational resources, connecting with others who are going through similar challenges.
Building that sense of community.
Exactly. And it shows how telepharmacy can address both the physical and emotional aspects of well-being. It's about comprehensive care, not just treating symptoms.
Well, I have to say, it all sounds pretty amazing, but let's be real, we're still early in this whole telepharmacy revolution.
We are, yeah.
There's a lot of work to do to make sure it really lives up to its potential.
For sure.
Mm.
Remember all those challenges we talked about? Ensuring equitable access, protecting privacy, navigating all the regulations. There's a lot to figure out.
And we can't forget about the human factor, really.
Yeah.
Making sure technology enhances that patient-provider relationship, not replaces it.
Absolutely. It's all about finding that sweet spot where technology and human connection work together.
And you're optimistic about the future of all this.
I am. I really believe telepharmacy has the power to change healthcare for the better. And if we work together to address these challenges, we can create a system that benefits everyone.
Well, you certainly convinced me. This deep dive has been eye-opening. It seems like telepharmacy really does have the potential to revolutionize healthcare.
It's been a pleasure talking about this with you and sharing it with our listeners.
And all of you listening, thank you for joining us on this exploration of telepharmacy. We hope you've learned something new and maybe even feel inspired to learn more. Talk to your doctor, do your research, and be an advocate for a future where healthcare is accessible and truly patient-centered. That's it for this deep dive. Until next time, stay curious.